Welcome back to Smitty's Learning Room. Today we're going to have a look at the dot point research and analyse cardiovascular disease, cancer and one other condition listed by investigating the nature of the problem, the extent of the problem, risk factors and protective factors, the sociocultural, socioeconomic and environmental determinants and the groups at risk. So obviously with this video we're specifically looking at cardiovascular disease, otherwise known as CVD. Cardiovascular disease has been identified as a health priority area because it's a major health and economic burden on Australia as a population. When we define cardiovascular disease, we're looking at the fact that it refers to damage to diseases of the heart, arteries, veins, or smaller blood vessels. Specifically, we have a look at the coronary heart disease, stroke, peripheral vascular disease, and congenital heart disease. When we start to have a look at cardiovascular disease, we look at two conditions, the arteriosclerosis and atherosclerosis. So arteriosclerosis basically looks at the concepts of the hardening and or narrowing of the arteries. So obviously if we're going to have a look at cardiovascular disease, we're having a look at the fact that we've got diseases that are affecting the heart or the arteries and the blood vessels that carry blood to the heart. So arteriosclerosis is a degenerative disease that affects most people to some extent as a part of the process of aging. However, this can be increased by risk factors relating to cardiovascular disease. So a form of arteriosclerosis is atherosclerosis. And atherosclerosis is the most common form of arteriosclerosis. And basically what happens is you get a build-up of fatty tissue around the interior walls of the artery, which basically means that blood flow has more difficulty travelling through the arteries, and therefore blood flow to the heart and the rest of the body is decreased. When we have a look at coronary heart disease, basically looks at the concept of poor supply of blood to the muscular walls of the heart by the coronary arteries, and is generally caused by a complete closure of the coronary artery by atherosclerosis, and may also cause when a blood clot forms and blocks the narrowed artery, which is known as thrombosis. Now, angina is a temporary loss of blood flow to the heart, so blood might just have a little bit of difficulty getting through to the heart. Common symptoms that are associated with heart attacks include sudden collapse or unconsciousness, shortness of the breath, nausea, vomiting, excessive sweating, chronic pain, which can last for several days, acute pain extending to the shoulders, neck, arm or jaw, and pain felt as a burning sensation in the centre of the chest. Another condition is a stroke. And a stroke is basically the interruption of the supply of blood to the brain. And a stroke may occur in a similar fashion to a heart attack. So a stroke basically occurs when there's been a blockage to the supply of blood to the brain, or an interruption to the blood supply. The effect of a stroke on a function of the body can be severe, even though the damaged area appears to be quite small. If the affected artery is large, then paralysis of one side of the body may occur. On the other hand, if the damage occurs to the dominant hemisphere of the brain, then the individual may lose the ability to speak. In many strokes and heart attacks, the actual breakdown is the end product of many years of fatty and fibrous tissue buildup associated with atherosclerosis. And this underlying cause may have gone unnoticed for up to 40 years within a person. Another condition is peripheral vascular disease, and it's basically looking at diseases of the arteries, arterioles, and capillaries that affect the limbs, usually reducing blood flow to the legs. This results in a cramping feeling within the muscles. The warning signs of impaired circulation to the legs and feet are tingling sensations in the feet and tightness or cramping in the legs or buttocks muscles, particularly after exercise. In extreme cases, the disease can lead to gangrene and subsequent amputation of the foot or limb. Significantly, 9 out of 10 people with peripheral vascular disease are smokers. Congenital heart disease is basically heart disease as a baby or at birth. And most of the times these diseases can be operated on, and if successfully operated, the child will go on to live a normal, healthy life. So now we move on to having a look at the extent of cardiovascular disease. So having a look at it, we know that cardiovascular disease is the leading cause of death and accounted for 30% of deaths in 2012, which is interesting to see that it's a 5% decrease from 35% of deaths in 2005. The people living in low socioeconomic status have 50% higher death rates from cardiovascular disease than those people living in city and built-up areas. And in 2012, cardiovascular disease resulted in 1.1 million hospitalizations. Having a look at cardiovascular disease, the levels of cardiovascular disease amongst men are much higher than what they are in women. And Hsc communities and Hsc peoples are 2 times more likely to suffer from cardiovascular disease than what non-Hsc people are. If we have a look at some of the reasons for decreasing mortality rates, the main ones are the fact that the modifiable risks for cardiovascular disease have been identified, and people are starting to make changes within their life and their diets to ensure that they are at less risk of obtaining cardiovascular disease. Having a look at other reasons why there's been a decrease in prevalence, we can have a look at the fact that there's been prevention strategies put in place by the governments. So, for example, smoking campaigns or new smoking laws have obviously decreased the rates of smoking, which is a risk factor for cardiovascular disease. And there's been an increase in medical care and treatment for people who have been submitted to hospital for cardiovascular disease. Now we have a look at the groups at risk. Obviously, one of the high groups at risk here are people who smoke cigarettes. We have low socioeconomic status groups, people with a family history of cardiovascular disease. We already know that males are more susceptible to cardiovascular disease than females. People aged over 65, people with high fat diets, and people with high cholesterol levels. When we look at the risk factors and protective factors for cardiovascular disease, now remember that risk factors are those factors that are detrimental to one's health, and protective factors are those factors that can improve health or support a person's health. Now when we explore risk factors, we need to make sure that we understand the concept of the fact that there's non-modifiable risk factors and modifiable. So if we have a look at these 3 here, we look at the fact that age, gender and hereditary are risk factors, and we cannot modify those risk factors. Having a look at smoking, high fat diet, high blood pressure, obesity, high blood cholesterol and lack of physical activity, these are all risk factors in which we can modify and have control over. If we come over to this side and have a look at the protective factors, so these are factors that can support us in improving our health and decreasing our chances of cardiovascular disease. We have regular physical activity, a low fat diet, low consumption of alcohol, low salt diet, stress management and avoiding smoking. Now we're going to have a look at how the different determinants can impact cardiovascular disease. Starting with the sociocultural determinants, look at those people who are more at risk are those people with a family history of cardiovascular disease, and those people in Hsc and low socioeconomic communities. And basically having a look at the Hsc and low socioeconomic are at more risk because they have less access to health and education services in order to educate them about making positive health choices and putting in protective behaviours in place. If we have a look at population groups which are less at risk, we look at different cultural groups. So, for example, Asians often have a low-fat diet, whereas if Eastern societies generally tend to have diets that are more high-fat, which would be more susceptible to cardiovascular disease. If we have a look at media exposure of the effects of smoking, they've led to decrease in smoking rates and therefore decreased rates of cardiovascular disease. Moving on to socioeconomic determinants, if we have a look at low socioeconomic or unemployed, they have an increased risk of cardiovascular disease. People who work in stressful work roles also have an increased risk due to the increased stress placed on the body and the heart. And people with low education levels also have an increased risk of obtaining cardiovascular disease. Finally, moving on to the environmental determinants, people living in rural and remote areas are less likely to access health services and information and also have less access to these services and information. And this is obviously in stark contrast to people who live in the city have an increased access to health services and facilities. So more likely to get regular checkups to check cholesterol levels or to have scans and tests done to test the quality of their heart. So that concludes the first video in a series of 3 to research and analyse cardiovascular disease, cancer, and one other condition listed by investigating the nature of the problem, extent of the problem, risk factors and protective behaviours, sociocultural, socioeconomic and environmental determinants, and groups at risks. Make sure that you watch the video on cancer and diabetes to make sure that you've covered that point in the syllabus.